Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome John Michael. He's a pediatrician. Today's Kevin MD article is How Attention Therapy Transforms Speech Delay in Young Children. John, welcome to the show.
Thank you very much.
All right, so tell us, before talking about the article itself, some context behind it. What made you write it in the first place and submit it to Kevin MD?
For many years, I have been practicing pediatrics, and in my training and in my clinical practice, I have been taught that when a child who is 2 years of age or 3 years of age has a delay in their speech, you should send them to a speech therapist.
Mm-hmm.
And then I realized that some of these kids were not progressing as well as they should. And the speech therapist would ask for more sessions, and the child still wasn't progressing as much as she should. So I started looking into why this was happening and why these children were not progressing. And it turned out, after I went to many speech therapists and behavioral therapists for children who have autism or other areas where they're delayed in their recognition or their speech or their attention, that many of these children, and I think close to 80% of these children, don't just have only a speech delay. They also have what's called an attention delay. They don't always respond to their name right away. They don't always follow directions appropriately. They don't always understand what is said to them. And that is what is causing their speech delay. So I decided to look into this even further, and found out that if you were able to get these kids to pay better attention, follow directions better, they would then be able to do much better with their therapy because they would be following the directions and paying attention to the therapist as well as to their caregivers and their parents. So I decided to put this together in a handout. I wrote it out. And over the past 5 years, I have put these together, all my handouts, into a book. And the book is titled Attention Therapy. Once you get the child's attention and the child follows your directions better, the child will learn much better, not only for speech development, but also in school.
Mm-hmm. So when you say that some children have an attention delay, go more deeper in that. What exactly does that mean?
Many of these children, most of these children, have a delay in their ability to understand what is said to them and recognize that people's voices are more important than what they want to do. Many of these kids are a bit self-directed and are more interested in what they think about than what another person wants them to think about.
Mm-hmm.
So I discovered that most children have developed good attention by 12 months of age. By 15 months of age, if they're not responding to their name, if they're not following directions, if they're not doing what they should be doing, then they have an attention problem. And many children by 18 months of age are really having severe issues. I have seen recently, over the last several years, many more children who have these delays. And they don't have autism fully. Many do, but many don't have autism fully. But what they do have is what is called attention delay, but what is really where they're more interested in following their own interests and not always following what is told to them or said to them by their parents.
And people who have this attention delay, they're not necessarily on the autism spectrum. Is that correct?
That is correct. And I don't know why this is happening. There's been a lot of research about this, and nobody seems to know what is going on. But there are many more children now who don't fully fulfill the criteria for autism, but who have an attention delay. They're not always responding to their name. When you ask a mom or dad, how often do you call your child's name to get her attention or his attention? They'll say, well, I have to call several times.
Mm-hmm.
And these children don't always follow directions. Like when you say, give me the toy or put the toy on the table, they will not do that. I don't know why this is happening, but a lot of children have this going on. And it's being missed by many pediatricians who are assessing these kids for their usual 1-year-old, 15-month-old, 18-month-old, 2-year-old evaluations. The pediatricians are not trained to look at this, and they're missing it.
And as far as you know from your research, any risk factors or demographic clues that would predispose some of these children to attention delays?
That's a very good question. And the answer is no one yet has come up to figure out why this is going on. Now, we do know that the criteria for the diagnosis of autism changed in 2013. And then, between then and now, the autism spectrum has become much wider, and more kids are now being diagnosed with it because now almost anybody can be diagnosed with it because of the spectrum criteria have been expanded so much. But I'm seeing children who are not fully on the spectrum, but are having these attention delays. The other issue is that when these attention delays are handled and improved, the kid's speech improves and learning improves. So that's why I wrote my book, Attention Therapy, which is on Amazon, for anybody who wants to know about how to do this.
So, how does one diagnose a child that may have an attention delay?
That's an excellent question also. It's hard, and many people miss it because you don't ask the right questions. What you need to do is when a child is 18 months of age or 2 years of age, and those are the two excellent times to check for this, what you do is you ask the caretaker, the mother, the father, whoever, you say, how many times do you have to call your child's name
Mm-hmm.
before he or she pays attention? You also have to ask the normal developmental questions. Does your child follow directions? Does your child ask you for help? Does your child point to things? All the usual developmental questions. And if the child does not do these things, then you have an issue going on. I
So,
always tell one more thing. I always tell pediatricians when I talk to them, look at the child's face and see if the child looks at or references someone who talks to them. And many people don't do that, but that's an important issue also. If a child does not reference or look at someone who talks to them, then they're not paying attention.
so if you suspect the child has an attention delay, tell us the path forward. What are some
Well,
potential
if
therapeutic
the child
steps?
has an attention delay, then the child often has a speech and language delay as well. And this is not hyperactivity or anything like that, or ADHD. There's no diagnosis for this yet. This is in between and not yet recognized. So the path forward would be to try to teach the child to pay attention. There are many different ways. Some work, some don't work as well. The way I have figured it out is to get something the child wants and then take that object and hold it up to your nose. For instance, if a child wants a train like this, you hold it up to your nose like this, and then the child looks up toward your face. And then as soon as the child looks at your face, you give the child the train. And the child, you do that several times, and the child will then realize, if I look at my father, if I look at my mother, I will get something. And then there are other ways of doing that I have in my book that talk about how to get the child to look at you and listen to you and pay attention.
And in terms of the prognosis and your success rates for these techniques, are most children able to overcome their attention delay?
The answer to that question is yes and maybe. There are some children who do very well with this, and I've had many parents tell me they really appreciate this because the child is now improving quite a bit. And there are a few who do not improve a lot, and I'm not sure yet why this is going on. There has not been a lot of data yet established to figure out what is going on with this. And that's what I'm trying to do right now, trying to keep track why they improve.
So obviously you're an expert in attention therapy, you wrote a book, but for those pediatricians and parents who may be listening to you, is this something that their own pediatrician can refer to? Are there specialists that can
That's
help
the other
specifically with this?
that's the other issue that is a difficult situation, because there are many behaviorists out there and many speech therapists out there who are dealing with children like this. Some of them know how to handle it and do a good job, and I know some of them. Some of them try their best to handle it, but don't know how to handle it. They don't know how to handle it. And so that's why I put this together, because certain methods don't work as well as others, and it depends on the child's personality. One therapy does not fit all children.
Mm-hmm.
It depends on how the child responds. But you have to recognize it first before you can actually put therapy together. And unfortunately, many doctors, family doctors, pediatricians who see children don't recognize that this is an issue. And I am finding it to be an issue. So more research needs to be done.
And just to be clear, most of the treatment techniques are behavioral health related. There's no role, for instance, for medications that can treat this.
This appears to be a brain development issue. And it's not a physical issue or a chemical issue that you can treat with medication or with injections. This is a behavioral issue and a brain developmental issue.
So tell us a success story where you diagnosed someone with attention delay that perhaps led to speech delay. You instituted some of the techniques that we're talking about, and you really moved the needle for that patient. Tell us what a success story would look like.
Just about a month ago, there was a family with a child who had a significant speech delay. And you know that parents recognize when the child has a speech delay. They don't always recognize the attention part of it. So the child was referred to us by the pediatrician for a speech delay. And then when we looked at that child, he was 2 years old, a boy who was 2 years of age. And when we looked at that child, it turned out he didn't always respond to his name appropriately. And he didn't always follow the directions his parents asked for.
Mm-hmm.
And so we then told them that they would be really helping him if they would try to use the attention therapy method over 6 months. It doesn't work within 1 or 2 months. It takes several months for the child's brain and the child to recognize what's going on. They said the child is now responding to his name and now following directions better and has developed better speech. The big issue is how to document this and how to put it in some kind of data so we have the data available. And that has not yet been done. So there are people out there who say, well, are you sure what you're doing is correct? Do you really know what's going on? And the answer is we're still in the beginning stages of this to figure out how this is working and how well it is working. Unfortunately, I don't yet know that.
We're talking to John Michael. He's a pediatrician. Today's Kevin MD article is How Attention Therapy Transforms Speech Delay in Young Children. John, let's end with some take-home messages that you would like to leave with the Kevin MD audience.
I think that my experience has been amazing to find this out. And I think it's very important for both parents and for physicians to be aware if they're seeing children at 18 months, 2 years of age, even 3 years of age, who are having any delays in their speech or their attention or their development, they should not just look at speech alone. They should figure out if there is a referencing or attention issue, if the child's not sharing, not looking at them, or just looking at the object rather than on the parent's face. They should then recognize that that can be and probably is causing the speech delay, and that needs to be dealt with first. Because if the child just gets speech therapy and not attention therapy, the child will not pay attention, and it will take much longer for the child to learn.
John, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thank you for having me.